And welcome to The Factor Uncensored. Thank you for joining us tonight. We have a great program with some very important issues right here in the community and around the country. Innocent newborns paying the cost for their parents' drug abuse. A new study shows how fentanyl use can affect babies in the womb. Researchers with the genetics in medicine found at least 10 babies suffered from birth defects in the womb, and that's only what we know about right now to this point in the study. They say it's due to their parents' fentanyl abuse. Conditions include webbed toes, toes that are fused together as well, deformed feet, and even thumbs that aren't fully formed. Dr. Danish Ali with Archpoint Pain Institute has more on the disturbing research.
It's just mind-blowing.
It really is, Isaiah, and unfortunately, it's been getting worse over the past 25 years. We've seen almost a 200% increase in these number of cases in these newborn children that are born with awful deformities, respiratory depression, rocker bottom feet, just muscle stiffness, this really high-pitched crying noise, and a lot of this has been now linked to specific medication, a specific drug that is responsible for these awful appearing children that we're seeing that have these really sad symptoms that they're experiencing, Isaiah.
And when we talk about fentanyl, and you and I have been ringing the alarm about this for years now on just how dangerous and how deadly it is, and now we see more results in deformities with children, conjoined toes. It's just mind-blowing.
That's correct. You see this muscle stiffness, Isaiah. You see these joined fingers and toes, like you said. And then also the respiratory issues. They have difficulty breathing. They have this very narrow face as well. And so, yeah, and we're seeing this because as a result of this increase in fentanyl. A lot of the times we're seeing folks obtain these medications or drugs off the street that they may not even be aware that it's laced with fentanyl. So therefore, my recommendation is if you have pain or you're suffering from other reasons why you may want to take these medications, seek professional assistance. There are other medications, there's injections, there's other things that can be done to avoid getting and obtaining these medications from the streets that have all these awful side effects and deformities that we're seeing in these kids.
Now, I think the researchers said it's a result of mothers likely using illegal drugs or fentanyl-laced drugs in the past. Is that do we know how far back that goes? Maybe the mother got off drugs, but still there's an effect. Or is it while she is pregnant, she may be involved in illegal drugs or some type of drug with fentanyl in it?
Yeah, great question. And it's usually when the female is pregnant, especially during the first trimester, when the DNA and all these things are forming together, embryos and embryogenesis is happening. That's when we're really seeing this. And a lot of times, unfortunately, mothers who may have been consuming these drugs in the past, they may not even be aware that they're pregnant. And so, especially if it's in that first trimester, therefore, if there may be any chance that you could be pregnant, it's very important to avoid taking, first of all, opioids in general, and number two, most specifically, fentanyl or any drugs off the street that may be laced with fentanyl or even oxycodone or any other opioid. I know right now we're talking about fentanyl because it is so potent, it's synthetically made, it's easy to reproduce, but there are other opioids, oxycodone, hydrocodone. These are all medications that can also cause similar effects as well, even morphine. Therefore, if you take any sort of opioids and there's a chance you may be pregnant, talk to your doctor, get checked out, and avoid medications, specifically medications off the streets that potentially may be laced with these deadly medications that could harm the child significantly.
And are we talking about, is there a role for the biological father? What if he's on fentanyl and he's a biological father of this child? Is anything passed on from him to that child, or it's only the mother?
It's only the mother right now is what we're seeing, Isaiah. It's not transmitted per se from sexually. And so our understanding is currently it's coming from the mothers. And a lot of times, as I said earlier, is that these mothers may not be even aware that they're getting these medications that may be laced with fentanyl or other opioids. And so, or that they're pregnant, right? I mean, if we're seeing all these things happening in vitro in the first trimester, they may not even be aware. So our message is a public service message. You know, if you're getting anything off the streets, be very careful, especially if there's a chance that you may be pregnant.
And of course, you're talking about a lifetime of care, not consistent care, but maybe corrective surgery, where these kids have to undergo some kind of reconstructive surgery to get those toes separated. It's going to have a long-lasting impact, especially if the parents don't have the money to correct many of these problems they're now being born with as a result of using fentanyl.
That's correct, Isaiah. And then the other thing is, you know, with all the respiratory issues we see, right? Shortness of breath, easily fatiguing, failure to thrive. And a lot of these kids, unfortunately, do not even make it to their teen years or adolescent years. And so, yeah, that's why, again, this is so important for us to talk about it, spread the education about, be very careful with obtaining these sorts of things over the streets, talk to your doctor, or if you have a history of using opioids, there are other medications that can be prescribed while you're pregnant that are not harmful to your unborn child.
Some horrible news here, Dr. Danish Ali, Arch Point Pain Institute. Of course, make sure you keep us updated on this and the latest developments. We've always warned people just how dangerous fentanyl can be, and here we're seeing the results, young, innocent children paying the cost. Dr. Ali, thank you for joining us here on The Factor Uncensored.